More than 37 million American adults are living with kidney disease, and most don't know it. There are a number of physical signs of kidney disease, but sometimes people attribute them to other conditions. Also, those with kidney disease tend not to experience symptoms until the very late stages, when the kidneys are failing or when there are large amounts of protein in the urine. This is one of the reasons why only 10% of people with chronic kidney disease know that they have it. While the only way to know for sure if you have kidney disease is to get tested, Dr. Vassalotti shares 10 possible signs you may have kidney disease. If you're at risk for kidney disease due to high blood pressure, diabetes, a family history of kidney failure, or if you're older than age 60, it's important to get tested annually for kidney disease. Be sure to mention any symptoms you're experiencing to your healthcare practitioner. You're more tired, have less energy, or are having trouble concentrating. Certainly, when kidney function declines, it affects your body's ability to cleanse the blood efficiently. Toxins and impurities accumulate in the bloodstream, leading to a condition known as uremia. Symptoms of uremia can include a general feeling of fatigue and a lack of energy, as well as difficulty concentrating. This happens because the toxins can interfere with brain function and the normal metabolic processes of your cells. Moreover, as kidney disease progresses, it can impair the production of erythropoietin, a hormone normally produced by the kidneys that is essential for the creation of red blood cells. This disruption often leads to anemia, characterized by a reduced ability of your blood to carry oxygen effectively. The result is an even greater sense of weakness and fatigue, compounding the direct impacts of the toxin buildup. This dual burden of toxin accumulation and anemia not only diminishes your physical stamina and mental focus, but also affects your overall quality of life, making everyday activities more challenging. Regular monitoring and early detection of these symptoms are crucial in managing kidney disease effectively and mitigating its impacts. You're having trouble sleeping. When kidneys aren't functioning optimally, their ability to filter and remove waste products from the blood deteriorates. This inefficiency means toxins accumulate in the bloodstream instead of being expelled in the urine. This buildup of toxins can significantly disrupt your sleep cycle, making it difficult to get a restful night's sleep. The presence of these impurities can overstimulate the nervous system or disrupt the hormones that regulate sleep patterns. Furthermore, there is a notable connection between chronic kidney disease, CKD, and obesity. Obesity increases the risk of developing CKD, and conversely, CKD can make managing weight more challenging due to hormonal imbalances and other metabolic disruptions associated with impaired kidney function. Sleep apnea, a condition characterized by repeated breathing interruptions during sleep, is also more prevalent among individuals with chronic kidney disease than in the general population. These interruptions in breathing can further impair sleep quality and overall health. The link between sleep apnea and CKD is thought to be due to a combination of factors, including fluid retention and increased neck size, which can obstruct the airway during sleep. Overall, poor sleep quality can exacerbate other symptoms of kidney disease and contribute to a declining quality of life, making it a critical symptom to manage in patients with CKD. You have dry and itchy skin. Dry and itchy skin is a common symptom that can signal underlying issues with kidney function. Healthy kidneys perform several crucial roles in the body. They filter out waste and excess fluids, aid in the production of red blood cells, help maintain strong bones, and regulate the balance of minerals and nutrients in the blood. When kidney function is compromised, particularly in advanced stages of kidney disease, these processes can be significantly affected. One of the critical complications associated with kidney disease is a condition known as mineral and bone disorder. This occurs when the kidneys are no longer able to maintain the correct balance of minerals, such as calcium and phosphate in the blood. An imbalance in these minerals can lead to changes in bone metabolism and increased phosphorus levels, which can cause severe itching and dryness of the skin. The skin may become dry and itchy due to the buildup of phosphorus in the blood, which is normally filtered out by functioning kidneys. This condition is not only uncomfortable, but can also be a marker of the severity of kidney disease. Managing these symptoms often requires treating the underlying kidney condition and may involve adjustments in diet, the use of phosphorus-binding agents, and proper skincare routines to alleviate discomfort. Regular monitoring and treatment adjustments are crucial to manage this condition effectively and improve quality of life. You feel the need to urinate more often. Feeling the need to urinate more frequently, particularly during the night, is a symptom that might indicate kidney disease. This condition, known as nocturia, can arise when the kidney's filtering units, the nephrons, are damaged. As a result, the kidney's ability to concentrate urine diminishes, leading to an increased production of dilute urine, which causes more frequent urination. This symptom of increased urination urgency can sometimes be mistaken for other conditions, such as urinary tract infections, which also cause a frequent need to urinate but are often accompanied by pain and discomfort. In men, an enlarged prostate can similarly lead to more frequent urination, as it can obstruct the bladder's normal flow, requiring more effort to urinate and increasing the frequency. In the context of kidney disease, increased nighttime urination can be particularly indicative of the condition because it suggests that the kidneys are struggling to perform their normal functions during the day and may be compensating by producing more urine at night. Addressing this symptom effectively involves treating the underlying kidney damage, which may include managing conditions like high blood pressure or diabetes that can contribute to kidney disease. Additionally, lifestyle adjustments, such as reducing fluid intake before bedtime, can help manage the symptom, but it's essential to consult with a healthcare provider to determine the appropriate course of action based on the underlying cause. You see blood in your urine. Seeing blood in your urine, a condition known as hematuria, can be alarming and is a significant indicator that something may be wrong in the urinary tract or kidneys. Under normal circumstances, healthy kidneys filter waste from your blood to create urine while retaining essential components like blood cells within the bloodstream. However, when the kidney's filters, known as glomeruli, are damaged, these blood cells can escape into the urine. Hematuria may manifest visibly as pink, red, or cola-colored urine, or it might be microscopic and detectable only through a urine test. While this symptom is commonly associated with kidney disease, it's important to consider other potential causes as well. For example, urinary tract infections can cause blood in the urine, often accompanied by pain or a burning sensation during urination. Kidney stones can also lead to hematuria, typically with severe pain. In more serious cases, blood in the urine can also be a sign of tumors within the urinary tract or kidneys. Because blood in the urine can stem from various serious conditions, it's crucial to consult a healthcare professional for a thorough evaluation. Diagnosing the exact cause of hematuria often involves urine tests, kidney function tests, and imaging studies like ultrasounds or CT scans. Treatment then focuses on addressing the underlying condition, whether it's managing an infection, removing or dissolving kidney stones, or more complex interventions for other kidney diseases or tumors. Your urine is foamy. Foamy urine can be a striking symptom, particularly when you notice excessive bubbles that persist even after flushing. This foaminess typically indicates the presence of protein in the urine, a condition known as proteinuria. One of the proteins commonly found in urine when these symptoms appear is albumin, which is also a major protein in eggs, hence the similarity in appearance to the foam produced when scrambling eggs. Under normal circumstances, healthy kidneys filter waste while retaining essential proteins in the blood. However, if the kidneys' filters are damaged, proteins like albumin can leak from the blood into the urine, creating this foamy appearance. Persistent proteinuria is often an early sign of kidney disease, particularly in conditions that damage the glomeruli, the kidney's filtering units. The presence of protein in the urine can also be temporary and caused by factors such as high physical stress, dehydration, or other transient conditions. However, persistent proteinuria requires medical evaluation as it can be indicative of chronic kidney disease or other serious renal issues. If you observe persistent foaminess in your urine, it's important to consult with a healthcare provider. They might conduct tests, including a urine sample analysis and kidney function tests, to determine the underlying cause of proteinuria. Managing this condition often focuses on treating the underlying kidney issues or other contributing factors to prevent further kidney damage. You're experiencing persistent puffiness around your eyes. Persistent puffiness around the eyes, often referred to as periorbital edema, can be a subtle yet significant sign of kidney-related issues, particularly related to the leakage of protein into the urine, known as proteinuria. When the kidney's filtration system is compromised, they may fail to retain essential proteins in the blood, allowing these proteins to escape into the urine. One of these proteins, albumin, which helps to keep fluid from leaking out of blood vessels when lost from the blood, can lead to fluid retention in various parts of the body, including around the eyes. This puffiness is more than just a cosmetic concern. It indicates that the kidneys are not functioning properly. The loss of protein not only leads to swelling but also has broader implications for overall health, as proteins play critical roles in bodily functions, including fluid balance and immune system support. If you notice swelling around your eyes that does not go away, especially if it is accompanied by other symptoms like foamy urine or fatigue, it's important to consult with a healthcare provider. They may perform a urine test to check for protein and other kidney function tests to assess the extent of kidney damage. Treatment typically focuses on addressing the underlying kidney condition and may involve lifestyle changes, medication to control kidney disease progression, and strategies to manage symptoms like swelling. Your ankles and feet are swollen. Swelling in the ankles and feet, also known as peripheral edema, can be a sign of decreased kidney function. When kidneys are not working properly, they may struggle to regulate sodium and water balance in the body. This inability to effectively manage sodium can lead to fluid retention, particularly in the lower extremities like the feet and ankles. This swelling can be uncomfortable and may limit mobility. However, it's important to note that such swelling is not exclusive to kidney issues. It can also be indicative of other serious health conditions. For example, heart disease. Inefficient heart function can cause blood to back up in the veins, leading to fluid accumulation in the lower body. Liver disease. Conditions like cirrhosis can impair the liver's ability to produce proteins that help maintain blood volume, leading to fluid leakage into surrounding tissues. Chronic venous insufficiency. This condition occurs when the leg veins cannot pump enough blood back to the heart, often due to weakened or damaged valves in the veins, causing blood to pool in the legs and leading to swelling. If you're experiencing persistent swelling in your feet and ankles, it's crucial to seek medical attention. A healthcare provider can help determine the underlying cause of the edema through physical examinations, blood tests, and imaging studies. Treatment will depend on the identified cause and might include lifestyle changes, medication to manage symptoms and underlying conditions, or other targeted therapies. Addressing the swelling early can help prevent further complications and improve quality of life. You have a poor appetite. A poor appetite can be a rather nonspecific symptom, but when related to kidney issues, it often ties back to the reduced efficiency of the kidneys in filtering out toxins from the blood. As kidney function declines, toxins accumulate in the blood, which can affect various bodily functions, including metabolism and digestion. This buildup can make you feel less hungry and may even lead to nausea or a general sense of feeling unwell, all of which can reduce your desire to eat. The impact on appetite can have significant consequences for overall health, as it may lead to inadequate nutritional intake and weight loss, which can exacerbate the weakness and fatigue already associated with kidney disease. Furthermore, a poor appetite can also be a symptom of other serious conditions, such as infections, other organ system failures, or psychological factors like depression. If you're experiencing a persistent lack of appetite along with other symptoms like fatigue or changes in urination, it's important to consult a healthcare provider. They can conduct appropriate tests to determine if kidney issues are the cause or if another medical condition is affecting your appetite. Treatment will typically focus on addressing the underlying cause and may include dietary changes, medications to help manage toxin levels in the blood, or other interventions to improve appetite and nutritional intake. Your muscles are cramping. Muscle cramping can be a distressing symptom often associated with electrolyte imbalances in the body, which can be directly linked to impaired kidney function. Normally, the kidneys regulate the balance of minerals and electrolytes in the blood, including calcium and phosphorus, which are vital for muscle and nerve function. When kidney function declines, this regulation can falter, leading to imbalances. Specifically, low levels of calcium and an accumulation of phosphorus, which are not uncommon in cases of advanced kidney disease, can contribute to muscle cramps. The imbalance between these two minerals can affect the normal muscle contraction and relaxation processes, leading to sudden, painful cramping. Additionally, shifts in other electrolytes, like potassium and magnesium, which are also commonly managed by kidney processes, can contribute to cramping. If you are experiencing frequent muscle cramps, particularly alongside other symptoms of kidney issues such as changes in urine output, fatigue, or swelling, it's important to see a healthcare provider. They can perform blood tests to check for electrolyte imbalances and assess kidney function. Managing these cramps often involves treating the underlying kidney condition, adjusting dietary intake of certain minerals, or using supplements under medical guidance to correct imbalances. This approach not only helps alleviate cramping, but also supports overall kidney health.